Hello, I'm Jeffrey Schneider. I'm Chief of Dermatology at the Kaiser Permanente Medical Center in San Rafael, California. We'll be talking to you today about sun protection and the things we need to do to help make it a more effective therapy. Sun protection is important because of the increasing burden of precancers in populations like Australia and the United States. 40–50% of people over the age of 50 or 60 may have these lesions, particularly in California. Skin cancers like basal cell and squamous cell, they make up maybe 2 or 3 million per year in this country. And melanoma, about 80,000 cases a year with about 8,000 deaths. And sun damage in general, with aging, wrinkling, modeling, and causing increasing problem in our population. Sun protection is well understood as a prevention for these problems, but I'm here today to make a case for you that it's not only a prevention, but a treatment. What's the evidence for this? Well, let me make a couple of statements first, that actinic keratoses and skin cancers are symptoms of sun damage, which is a field problem, not a local spot problem. The majority of actinic keratoses, the precancers, spontaneously resolve in a year without treatment, and only a very few will progress to skin cancer within a year. Actinic keratosis spot treatment with freezing or biopsies are useful for growing symptomatic or painful lesions that are suspicious for skin cancer, but has no effect. Treatment of these has no effect on the overall number of precancers. Field therapies significantly reduce the number of actinic keratosis after treatment, but over months to a few years, they are not usually more effective than sun protection alone. Field therapies include topical chemotherapy like Aldara and Effudex, lasers, peels, and photodynamic therapy. These have been shown in studies to reduce the number of actinic keratosis, but only 2 studies have looked at the long-term development of squamous cells, which is the bottom line for what you want to protect with these treatments. One study looking at imiquimod Aldara showed that a lesion that imiquimod applied only once showed a reduction in squamous cells, but was not significant. And in a second study with immunosuppressed patients, photodynamic therapy done every 1 to 2 months over 2 years showed a significant reduction, but this is a therapy which is painful, costly, disfiguring while you're getting it. You cannot go out, hardly go outside after almost looks like a burn on your face. It takes about a week for you to recover from that. So this is quite a therapy, and in fact, after all that therapy, you don't do any better after 2 years than another study showed with immunosuppressed patients from organ transplants, and a study done in Germany, that in these patients there was a majority of the lesions were resolved over 2 years of the actinic keratosis, but even more impressively, squamous cell carcinoma stopped in that group, even though they'd had a significant number before that. In the control group, there was 9 squamous cell carcinomas. So this was a significant change and a dramatic change in the treatment group versus the control group, and the photodynamic therapy didn't do any better than that. Furthermore, people who do these field therapies need sun protection to maintain the benefit, and if they don't, they'll lose the effect. The sun damage will then begin to increase the problem again. So sun protection is the first line of therapy, and it's the foundation of sun protection. Now let's talk a little bit about the sun rays. The 2 components of sun rays that are important to understand is what's called UVA and UVB. UVB is the sunburn rays. Those are the rays that come in the midday from 10 to 11, 3 to 4 in the spring, summer, and these cause burns. Now, the peak of this period is at the midsummer solstice. So for the 3 months before and 3 months after are the times that it's most easy to get sunburns. UVA, on the other hand, is equal summer and winter, from sunup to sundown. It doesn't produce burns except in unusual circumstances, but it does cause slow damage. It causes precancers, skin cancers, and marks on aging and modeling. Let me just show you a dramatic photo from the New England Journal of Medicine, which is a gentleman who was a driver of a truck, and the truck window was always closed, but he got sun through the window glass on that side of his face, and you can see the dramatic aging effects of the sun damage, which was only UVA because the window glass blocked all the UVB. So UVA alone was enough to cause that dramatic changes. So what are the things we need to do to protect ourselves from that? Clothes are the cardinal foundation. A broad hat and shirt. So a broad hat, we're talking about a very light hat with a nice broad brim and ventilation like this, which keeps it comfortable. A shirt, long sleeve, with a thin material that's so light you can actually feel wind through it, yet it's very sun protective. So very comfortable. You can wear this shirt about as comfortably as a short sleeve shirt and get tremendous sun protection. We'll go over companies that make these kinds of shirts and how useful they are in a subsequent video. So sunscreens are a good supplement to that. They're particularly good at blocking UVB, the sunburn rays, but they're much weaker at blocking the UVA, which we know causes aging, wrinkling, mottling, and skin cancer. So they're really not that effective on their own, but people do use them, and they're prone to failure. We'll talk about why. The first reason sunscreens fail is people don't put on enough. People on average, when given a sunscreen and told to apply standard for them, they put on a half to 1/3 of what's needed to get the full listed SPF on the bottle top. That's probably okay for UVB, where we have sunscreens now that are up to 100. So half or a third of that will give you 25, 30 in that range. So that's fine. But unfortunately, the UVA side of the sunscreen, they're much weaker in this country. We don't have the ingredients we have are more limited. And so if you're talking about reducing the UVA effectiveness of the sunscreen by half to a third, you're really getting inadequate UVA protection and making yourself susceptible to the things we showed. Other problems, people miss spots. So people get these hot burn spots where they miss it. It washes off fairly easily, even the ones that are labeled as sun resistant, as sunproof, waterproof. And in fact, the FDA is changing that terminology. They're going to call them only water resistant, which is all they are. And it'll rate them as being good for 40 minutes or 80 minutes in the water. Now that's lying motionless in the water. So if one's swimming or sweating and wiping it off, they're gone in significantly less time. What makes up a good sunscreen? Well, we talked about the SPF, which stands for sun protective factor. That is a rough estimate. If you would say normally take 10 minutes to burn in the sun, if you had an SPF sunscreen of 10, it would take you 100 minutes, 10 times longer. So you'd like to see an SPF in the 20 or higher range. How much higher doesn't usually matter if you put it on properly. If you're putting on inadequately, it helps to use a higher one. But even if you do that, if you're pointing inadequately, as we said, you won't get that good UVA protection. The best UVA protectors, and you should look for this in the sunscreen, you have to look in the ingredient list, are 3% avobenzone or parasol 1789, or at least 7% zinc oxide. In the future, the FDA is going to help us by using something called the critical wavelength, and sunscreens will be rated as broad sun protective or not. But at the moment, we have to read the labels. The other thing to think about is vitamin D. Doing the kind of sun protection I'm talking about is going to reduce the amount of vitamin D you'll make from the sun, but it's easily supplemented in foods or in multivitamins, which have been shown to be safe and possibly have some cancer-preventing factors of their own. So it's certainly a reasonable thing to take a multivitamin if you have any concern about your UVA, vitamin D intake. So to summarize, sun is necessary for life on Earth, but it's harmful to the skin, especially to fair and medium-skinned persons, and protection is needed to reduce the burden of precancers, skin cancers, and premature aging and mottling. I think I've made the case that sun protection is both prevention and therapy, and it's even good for the most cancer-prone patients. Thank you for listening, and I hope you'll be joining me for some other discussions I'll have in subsequent videos talking about sunscreen application, and give you also another videos dealing with tips on different activities and what things you can do to help sun protect yourself. Thank you.